Good morning. Today we came to discuss body composition. What exactly is body composition? Well, body composition is used to describe the percentages of fat, bone, water, and muscle in an individual's body. Studies have shown that excessive body fat, especially central body fat, is associated with hypertension, metabolic syndrome, diabetes, stroke, and cardiovascular disease, also known as CVD. There are a few ways to measure body composition. You have expensive methods and also feasible methods. Inexpensive, cheap, quick to administer. Some of those expensive methods includes the DEXA machine, CT scans, MRI scans. Would any of you all be able to name more feasible methods or less expensive methods of taking body composition? Great answers. The anthropometric methods I decided to use include body mass index, also known as BMI, waist circumference, along with the waist to hip ratio, and last but not least, the skin fold test. Raise your hand if you are familiar with any of these methods. The first method we're going to discuss is BMI. BMI measures your weight relative to your height. The units used with BMI are kilograms divided by the height in meters squared. Equipment needed to calculate BMI is a stadiometer and also a scale. Height and weight measurements should be taken with shoes off for more precise measurements. Even though BMI is a quick way to measure body composition, as a lot of methods, BMI has a flaw. The biggest flaw in BMI is it does not distinguish between fat-free mass and fat mass. With this being said, someone with a real athletic structure may be classified as overweight or obese if you're just looking at their weight relative to the height. But technically, they're not really overweight or obese for the simple fact they're just muscular. Now, does anyone know the BMI classifications? Raise your hand. BMI classifications include normal, overweight, obese, severely obese, and morbidly obese. The normal range starts from 18.5 to 24.9. I personally believe if you're below the 18.5, you should probably start eating more. Next is the overweight category, which is 25 to 29.9. Obese is 30 to 34.9. Now, these two groups are usually put together, but there's a significant difference between being obese and being overweight. The severe obese category goes from 35 to 39.9. BMIs greater than 40 is classified as morbidly obese. Individuals in the normal and overweight range should follow ACSM's normal recommendation for physical activity. Now, the individuals that are obese, severely obese, and morbidly obese may need to increase the those recommendations so they can lose the excessive body fat, which is essential for their health. Here's a look at BMIs that I calculated. The first subject would be considered overweight, just like the second subject, because both of these people fall in the 25 to 29.9 category. Now the third subject was in the normal range. Now sit back and relax, stretch out a little bit, and watch this short clip.
In the course of the last century, our standard of living has improved considerably. Today we usually work with less physical exertion, and we have more than enough to eat. In itself, this is a very positive evolution. But on the other hand, our weight has also increased. But someone who is heavy isn't necessarily obese. In this film, we look at a number of methods that can help you determine your ideal weight. The Body Mass Index, or BMI for short, is an international value for the weight of a person older than 20 years. A BMI between 18.5 and 24.9 is considered by the World Health Organization as healthy. Anything above a BMI of 25 is considered overweight. A BMI of more than 30 indicates serious overweight or obesity. You can calculate your body mass index as follows. Divide your weight in kilograms by the square of your height in meters. For example, if you weigh 60 kilos and your height is 1 meter 70, then you have a BMI of 20.8. The BMI calculation, however, also has its limitations. Look at these two men. They are the same size, have the same weight, and therefore have the same BMI. Therefore, the BMI calculation should be seen only as a guideline, a tool to help you find out whether or not you have too much fat. You can also calculate your ideal weight as follows. Multiplying the square of your height by 20 gives you your ideal minimum weight, and the square of your height multiplied by 25 gives you your ideal maximum weight. Imagine that you are 1 meter 70 tall. Then your ideal weight lies between 57.8 kilograms and 72.2 kilograms. In addition to the quantity of body fat, the distribution of it also determines our health. Fatty tissue can be concentrated in different parts of the body. So someone with a round shape, or rather lots of tummy fat, has a higher health risk than someone who is pear-shaped, where the fat is concentrated more on the thighs and hips. Are you a man with a girth or waist size of more than 102 centimeters? Then, even with a normal weight, you still have an increased risk. For women, this rule applies with a waist size of more than 88 centimeters. In any case, whether you're fat or thin, live healthily and feel good.
Now, wasn't that interesting? The second method we're going to go over is waist circumference. Equipment needed for waist circumference is just a measuring tape. This is a real quick indicator that assesses cardiovascular disease. Waist circumference is also known as waist girth. Men that are in the high-risk category for waist girth fall into a category between 100 and 120 centimeters. For women, it's 90 to 110 centimeters. For precise measurements, the subject should be wearing minimum clothing, and the measurement should be taken immediately above the iliac crest. To take waist circumference a little bit further, we look at another ratio, the waist to hip ratio. This is also a more accurate way to predict cardiovascular disease because it shows fat distribution. You have android and gynoid fat distribution. This will be later explained. Now, I would like for you to think about which range you fall into. For males, individuals that are at risk, have a waist to hip ratio that is greater than 0.95. And for females that are at risk, they have a waist to hip ratio that is greater than 0.86. Now, good and average are anything below 0.95 and 8.6. Do you know the difference between android and gynoid obesity? Well, android is known as the apple shape, which also is prevalent in the male population. This is described as excessive body fat in the abdomen area, and it has a significant correlation with metabolic syndrome. The gynoid obesity is more so like a pear shape, and this is prevalent in the female population. It is non-significant with a correlation with metabolic syndrome, and it's more common to have fat around the thighs and the buttocks. Considering the fact that android obesity is more central, closer to the heart, these individuals are more likely to have diabetes, CVD, hypertension, and premature death compared to the individuals with the gynoid obesity. It is recommended that both categories partake in 150 minutes per week of physical activity. Considering the fact that android apple-shaped individuals have more central obesity, it is essential that these individuals should reduce the fat around the heart. Here's a look at a few waist to hip ratios. As you can see, the subject 1 was a male, and he falls into the low category. Subjects 2 and 3 were females, but they also fell into the low risk category. Now, are y'all ready to learn a little bit more about the waist to hip ratio? Raise your hand.
Studies indicate that compared to BMI, waist circumference is more accurate in regards to predicting cardiovascular disease risk. Waist circumference can be measured at the midpoint between the lowest rib and the iliac crest. Unsure what the iliac crest is? It essentially acts as the main hip bone. It can be felt by putting your hip at the lowest rib bones and simply sliding it down the abdomen until you reach the top of the pelvic region. Research has shown that waist circumference is effective in identifying cardiovascular disease and diabetes risk. Here's a table that shows the criteria for waist circumference in adults. For accuracy, it's important that the measurement is taken at the end of expiration, at the point when the diaphragm is in its neutral position. It's also important to keep the tape measure snug, but not too tight that it presses into the subcutaneous layers. Another measurement that can be used, and research has shown to be the superior clinical measurement for predicting cardiovascular disease mortality, is the waist to hip ratio. For this assessment, the hip measurement should be taken at the greatest circumference of the buttocks. You'll then find the waist to hip ratio by taking the waist measurement you completed earlier and divide it by the hip measurement. This table shows the waist to hip ratio norms. For the waist circumference and the waist to hip ratio, for accuracy you want to ensure that you're completing the measurement at the same landmark each time. It's also helpful to complete multiple measurements at the same site, but to ensure that you allow at least 20 to 30 seconds between repeat measurements to allow the skin and subcutaneous tissue to return to its normal state. Research has shown that these measurements demonstrate a strong correlation between health, morbidity, and mortality, but it should be noted that they serve only as an estimation of body composition and fitness level. For a more three-dimensional view of the makeup of the body, especially if you have weight loss goals, consider enlisting the help of an ACE-certified personal trainer who can provide additional assessments, such as skin fold measurements, to more accurately assess your body composition.
The skin fold measurement is a good measurement to predict body fat percentage. Now, all you need is a caliper, tape, skin fold measurements. The issue with skin fold measurements would be lack of experience, lack of technique, excessive body fat, or excessive muscle. Skin fold test takes the sum of 3 to 4 sites, and then you plug them into an equation which differs between males and females. Now, are any of y'all familiar with these skin fold sites? If so, raise your hand. Skin fold sites differ between females and males. The sites for females include the triceps, superilium, and the thigh. So ladies, if anyone tries to get a chest measurement, you should tell them no. They're trying to get off on you. As stated before, it's a little different for males. For males, you actually have a chest measurement, and you have an abdomen measurement. And the one measurement that is the same as the thigh measurement. Always remember to take these measurements 3 times for accuracy, and do not take the measurements back to back. Do them in a rotation format.
First, we'll be showing you the 3 sites for women. The first site is the tricep, so if Katie could please turn around. Ask the client to hold their arm at a 90-degree angle, and then measure in centimeters from the acromion process down to the elbow. Katie is 35 centimeters long, and you want to make a mark at the halfway point. Now this is a vertical test, so you want to make your line vertical and then cross it horizontally to mark your spot of testing. Go ahead and relax. And our second test site will be the abdominal. Again, measuring in centimeters, and on the same side of the body, mark 2 centimeters out from the belly button. The last site of testing is the suprailiac. You'll find the natural line of the iliac bone and go just superior to that and make a line in the direction of the bone, so it's a diagonal test. Now for the actual testing, you want to make sure your client is relaxed. Wherever you made your marking, you're going to pull the skin out just a little. Try and separating the fat from the muscle. Take the skin caliper and place it at the base of what you've pulled out. Let it sit for a second before you take your reading. The number's on the dial, and then press the button and take it away. Next, you'll ask the client to turn around and continue on the next 2 sites. Again, a couple pinches, pull the skin out, open the caliper, place it at the base, take your reading, open it again, and take it away from the client. You'll do each site 3 times, rotating between the 3. Make sure you don't do all 3 at one site at one time. Again, the 3 testing sites on women is the tricep, the abdominal, and the suprailiac.
Are you all still hanging in there? Don't fall asleep on me just yet. In conclusion, we have discussed body composition and how it describes the percentages of muscle, fat, bone, and water. We also have talked about simple methods of taking body composition, such as body mass index, which is also known as BMI, waist circumference, and skin fold. With that, we also talked about the risk factors associated with high BMI and high waist circumference and high body fat percentages. Remember, exercise helps solve problems, but not only solve problems, but exercise helps prevent problems. I'm Askia Brown. Thank you for your time.